From KETK, you're watching East Texas Live.
Welcome back. Joining me now is Deirdre with Bethesda, and she's here to tell us about their pediatrics clinic. How are you doing today?
I'm good, thanks. How are you?
I'm doing awesome. So what is Bethesda Pediatrics and your role with them?
So Bethesda Pediatrics is a nonprofit clinic. We're part of Bethesda Healthcare Clinic. Bethesda's been in business for about 20 years, providing lower income families with affordable health care. And so Bethesda Pediatrics is now a part of that. We provide comprehensive medical care, dental care, and mental health care for kids.
Yes, ma'am. And what are the most common illnesses you see in children during the fall and winter months?
So in the fall and winter, kids are indoors more, they're around their classmates more at school, and there's less opportunity for fresh air and sunshine, and that is when we tend to see more viral illnesses kind of take a jump, things like flu, colds, RSV, even croup sometimes. So things like that can make kids really feel really bad and miss lots of days of school.
Yes, ma'am. And so how can parents tell the difference between a cold, the flu, and allergies?
Sometimes it's tricky. Allergies typically do not cause a fever, usually. Allergies can cause like a runny nose, cough, watery eyes. Colds tend to cause a little bit of a fever, but can also have a runny nose and a cough. And then flu typically causes a higher fever. So anytime they're running a fever, we encourage people to get checked out by their doctor. Let us take a look and see if it's something that we can potentially help with medicine interventions.
Yes, so and how is Bethesda Pediatrics preparing to meet the increased need for care during the flu season?
So we have adjusted our schedule to open up more sick visits for kiddos. We always have a certain allotment of well child visits and sick visits every day, but we've made an adjustment to kind of increase our ratio of sick visits that are available. So anytime a child needs to be seen, we're going to do our best to get them in.
Yes, and what does it mean to be able to offer this kind of services to the community for their children?
So our goal is to help meet their needs and hopefully even prevent worsening of their condition. So when kids get a viral illness, sometimes there may or may not be medicine that can help with that, but they can sometimes turn into a secondary infection like an ear infection or pneumonia. So we want to do an assessment, see how sick they are, and if there is something we can intervene with and hopefully prevent them from getting really sick or even needing to be hospitalized. So that's very meaningful for to be able to do that for our community, but we're also hoping to improve their long-term health and prevent them from some serious consequences and hospitalizations.
Yes, sir. And why is it important to have access to affordable pediatric care families kind of face seasonal illnesses?
So if kids are getting sick, repetitive illnesses, and their needs are not being met, that is when we see those chronic diseases start to develop, and also can lead to missing school and missing, multiple days on end, and that can really put a child behind. So not having access to good medical care not only affects their health, but it can also affect their education, their grades, and it can even lead to having to be held back or having shortcomings and educationally. So we really want to meet the needs of kids early on and have availability for all kids regardless of their income status.
Yes, sir. Real quick, where can people get more information?
Sure, they can go to BethesdaPediatrics.com. They can call us and we'll be glad to make an appointment. There are some same-day appointments available. We're just ready to help kids out.
Yes, ma'am. Well, thank you so much for coming in.
Thanks for having me.
Yes, ma'am. For more information, go to the website right there on your screen.